Thank you very much for giving us the opportunity to provide opening remarks. Today we'll talk about how we manage heart diseases and how to live healthy with it. We would like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, Teslevatlat peoples. I would also like to acknowledge that you're joining us today from many places, near and far, and acknowledging the traditional owners and caretakers of those lands. And I will ask Ripujit to tell us about her. My name is Ripujit Karundava. I belong to city of Bathinda, but I was born in city of Faridkot. I did MBBS from Ludhiana, then MD anatomy from Amritsar. With that, I'm connected to Panjabi culture, and I joined the dance, Gidda, Uli, and Pangra teams of the college and MC College. With my education, I joined culture programs and I also joined conferences and as well. And I was attached to different forums. Thank you. Let me tell you something about myself. My name is Aline, and with iCON for 6-7 years. Other than joining iCON, I'm pharmacy specialist in medicine, and my purpose of today with iCON is that you understand about your health, about your rights, so you know about those, so you can get information about your health. You can get all the information today so that you can take care of your health in future. What is iCON? iCON is Intercultural Health Network. It's with the University of British Columbia with the digital emergency medicine. With iCON, Ministry of Health also supports iCON, and they are partners with it. Why iCON does this programs? To assist multicultural and indigenous citizens, patients, and caregivers. If it is you or your family member, or your healthcare team, your doctors, pharmacists, dietitians, or your physiotherapist, occupational therapist, any team members that assist you, so you can get information about that. So our focus is to optimize chronic disease prevention and self-management. There are many examples of chronic diseases like hypertension, blood pressure going up, diabetes. You can also call it blood sugar. And these are just examples of some chronic disease. The chronic disease, why they are so important? Because sometimes they are with us for so many years, sometimes we don't know how they will affect our health for longer years. Sometimes we have it for so many years and we don't have any problem. Sometimes you have blood pressure, and for many years those can occur, and it can affect your heart, and it can affect your brain and your kidneys. It can affect your kidneys as well. So about all that we will talk, and we wish to talk about those so you can get all information about those subjects. We also want you to know if you want to get some information online, if you read anything online, then you should know what you're reading, it is reliable or not. We also want to tell you that today. We also want to tell you the professionals, the specialists that we have today, you can talk to them today. Now I wish to invite our first Dr. Baldev Sanghera, family physician. And Dr. Baldev Sanghera has been practicing as a family doctor, and he will tell us how to make our life better. Dr. Sanghera.
Hello everyone, welcome. My name is Dr. Baldev Sanghera. I'm a family doctor. We today we will talk about heart disease. Learning objectives today are what heart disease is and how you recognize the signs and symptoms, how you recognize the symptoms, what are the reasons, what we will talk about that, and along with that, how we manage the heart disease, how we treat it, we will talk about that as well. If we don't manage it, what problems or difficulties we can face later on. The heart disease, we say it in English. In Panjabi, we say it heart. We also call it a cardiovascular disease. There are a lot of types of this disease. It depends on the type. Yeah, what it depends where the problem is, what part of the heart structure, or we usually hear that somebody got a heart attack. Heart attack is one of the types of heart disease. All of the other types, it depends where the heart muscle is problematic, or what, or if we have problems with our arteries, the blood vessels that take blood to the heart or to the body. If there are problems in either one, so we can see here on the left side is the heart. Where I place my hand in on my chest, the heart is present there. Yeah, the it's about our fist, the size of our fist. We think it's too big, but it's not good to have a big heart. Uh, it's a symptom of something wrong. But if it's too small, it's good either. And the arteries, you can see the blood vessels, small blood vessels. So if there is a clot, if it's, and then we say it's heart attack. If something like clot stuck in that, the other side you are looking at the photo. There are four. It's like four rooms. There are four parts of the heart. Two are big on the bottom. On the right side of the heart, there comes the blood that is not, there is not no oxygen. On the left side, that the blood that comes there is, that's oxygenated. So the main purpose of the right side is to pump it to the lungs, and then in lungs the oxygen goes in the blood from the lungs, and then is pushed to the body parts from the right side of the heart. If you see the picture on the left side, you will see the heart muscle is little bit rigid or stiff, and then it makes the blood go in our body. And the blood vessels we are talking about, the rooms, in between the rooms there are small valves. The blood vessels, that when they are clogged, then the heart muscle cannot receive oxygen and it becomes rigid and stiff. So then the heart can stop for 3 to 4 minutes, and that's called heart attack. That if you look at the picture on the left side, the electric current starts and it goes through the mass or the muscle to the bottom of the part, and then it goes and goes upside from the sides. That's how our heart beats. If there is a problem with the current reaching on the bottom or on the sides, then it will be irregular heartbeat. If the heart muscle contracts too much or gets pressure too much, then something is wrong. If there is inflammation in the muscle or swelling in the muscle, if somebody drinks too much or there is too much stress, that could be the reason. That's called cardiomyopathy. This is one type of heart disease. The heart valves, they are present in between the rooms, you can say, that regulates the blood to go down or up. If there is a problem in the valve, if there is a problem in the valve, then there is a pressure on the heart. The heart, if they don't close properly, they should be closing properly. If they are not closing properly, then there is a problem. Sometimes they leak, that's not right either. So there will be problem with the circulation. Sometimes the valve, there is some kind of mass that get deposited on that, then there is a problem as well. You may be heard about heart failure. The heart failure means the current that goes through our heart, it should be contracting with that. If it's not proper, if it's not properly forced, then it doesn't work. And if the current doesn't work properly and it's not contracting, and then it's irregular, and that's not good either. Sometimes you are born with it. The children are born with that heart disease because the blood vessels are not connected properly or not properly formed. And sometimes the children born with that, there is a problem with that part of the heart, and the blood doesn't flow properly through the blood vessels because they are not connected properly. What are the symptoms of the heart disease? What you feel when you have heart disease? We usually hear that there is a chest pain. There is pain in the chest. There's the common symptom, very common symptom. We also call it angina. Sometimes when you try to exercise, try to go up the stairs, you feel chest pain. When we are in a shock or trauma, we feel chest pain. Yeah, then there could be pain in the chest. Sometimes you also have shortness of breath. Some people don't feel angina, chest pain, but they feel shortness of breath. It's not only pain in the chest. Sometimes it go up in the neck, in the shoulders, and sometimes pain it could go throughout the body. There are some people, they don't feel any pain. They feel weak, they feel nauseated, they feel dizzy. So these are all the common symptoms of heart disease. If there is a heart failure, if the heart is not pumping, then there will be water in our body. These are the symptoms. Uh, these symptoms are different sometimes with men and women. They are not the same. All the books that are written so far, they are talking about the middle-aged white people. Sometimes we have seen there is a weakness in woman. She cannot play with children. She is feeling dizzy, nauseated, and then it's better to check the heart with all these symptoms. So if you feel any symptoms from these, go to your family doctor, talk to him, and ask him to check why these symptoms are happening. And risk factors for heart disease, they are different. Very important is if there is the heart disease is present in our family, if somebody who's older than 50 or 55 and they got the heart disease, they should be careful in the beginning. Then they should be careful if there's a present in the family. They should be careful from the younger age. So the lifestyle, the way we live, that's very important as well. lifestyle should be healthy. We will talk about it when we move forward. So what you eat, you should be careful. Don't No excessive use of alcohol. Um, Control your blood pressure and control your cholesterol levels. Try try to keep your cholesterol lower than 5 or 6. And take care about your sugar levels. Um, Careful about your what you eat. If we are not involved in physical activity, that's not good either. That could affect. So if we smoke, that also affects the heart. A lot of people heard about that. If you are drinking, having 2 drinks a day, then there is not a big problem. But now we have seen in the recent studies, don't drink more than 2 times in a week. That will affect your heart. If you feel any symptoms, what you should be doing? If you wanna diagnose your heart disease, talk to your doctor. Tell them to check if I got it or not, or if I have risk factors for that. When you go there, they will ask your medical history and your symptoms and medical background, and you can provide all the information. Whatever you feeling, tell him. If we need further information to provide, ask questions, and if he asks questions, you answer, and there will be tests, blood test, diabetes, cholesterol test, hemoglobin. They will check. They will check kidney function, liver function, and they will do the ECG also, like how your heart is functioning. They will check. If there is a problem in these tests, if they find out anything, then they will refer you to the heart specialist and they will do the further testing. The additional test may include treadmill test. uh, then they will make you run or walk on the treadmill, how long you can walk or run. Some people can't walk or run. If they can't walk, they have pain in knees or pain somewhere in the body or in the hips or in the joints. Then there will be radionuclide scan that will check your heart functioning. And if they need further testing, they will do CT scan, MRI scan. They can do to diagnose that. They will insert a dye and do these tests. And then that test is not ardiogram, and the ultrasound of your heart, how it's moving, how are the valves moving, how is functioning. All these things can be checked through that test. If there is any doubt in these tests, maybe our blood vessel is clogged, then the coronary angiography is done. If they will put a tube, and then where they will insert a dye, and then they will see which blood vessel is flowing and which one is clogged. If we find out we have a heart disease, then what should we will be doing? The first of all, make lifestyle changes. Bring changes in that and manage it. Do regular exercise. 30 minutes walk 30 minutes every day. You should be walking, and have 150 minutes of regular exercise per week. If we walk about that much amount of time, then it's good. And then the weight should be according to your height. Most of in our Panjabi, when we don't have any problem, we don't accept it until we get into the problem. In Punjabi, people, so it should be less than 3 inch. the in a woman it should be less than 33 inch. In our culture, in our people, we should pay more attention. If you don't have a belly, it's good. But the weight should be according to your height. The other things that we should be controlling, we should quit smoking. It will only bring you diseases, nothing else. The only illness, nothing else. As I told you earlier, not more than 2 drinks in a week. You are calling the illnesses in if you are doing it more than 2 drinks per week. And then if we talk about the diet, eat everything but in small amounts and control the portions. We need the carbs, we need all the vegetables, we need the fruits, we need the protein. You shouldn't be stopping anything from all these four different food. The body repairs itself. If we talk about the treatment here, there are two purposes of treatment. The one is to control the symptoms of heart disease, how to manage the heart disease, and the second is that we want to stop it to be. If we want to control the symptoms, how we can control our heartbeat. Now, it shouldn't be going up or low. The both things are not correct. So there are muscles around the blood vessels. We can relax those muscles. There is a medication for blood pressure that the blood flows through our body, then it will put less pressure on the heart. If we want to reduce the risk factors, then try to lower the cholesterol levels. It depends. If you are already have heart disease and you know that your arteries are blocked, the LDL cholesterol should be from 8. If the blood vessels are not clogged and we have other symptoms present in our body, then it should be 2.0. Try to keep it low. Try to keep the low levels of cholesterol. Control your sugar intake. If you take the sugar, when we check every 3 months, see it should be less than 7. If it's checked every 3 months, if you already have if you are already have diabetes, so every 3 months it should be checked. Keep your blood thin. Then the blood circulation will be easier, and then heart has to work less. So keep your blood thin. Take aspirin to keep it thin. ASA blood thinners. And we already talked that the heartbeat should be regular and it should be controlled. Then it will try to make the heart disease less. And if you already have and it's escalated and the blood vessels are clogged, then and there is a treatment for the called angioplasty, where we put a stent and try to widen the blood vessels. That's called putting a stent to make the blood vessels wider, so that then that's the other is the surgery. Then we open the chest and then we take the arteries from the legs and insert it in the heart.
And just in case we have a heart attack, then we should be able to, it should be our attempt to get the life back to normal as it was earlier, to get it better. Don't smoke, decrease your alcohol intake, If you already had a heart attack, you have irregular heart rhythm, then alcohol can cause swelling. And along with that, we should talk to our family how they can support us and how we can get more support. If we have a lot of stress in our life, we should try to decrease that and talk to our friend or doctor and talk to a counselor how to reduce stress or tension in our life. And we should also make better choices for eating, exercise, continue doing that. The best exercises are, as we talked earlier, 150 minutes per week walking, like a brisk walking, jogging, swimming, cycling, climbing stairs, rowing, or going up the stairs. If we have it, we should use that. And rest, whatever we do, whatever we can make changes to our life to better health, we should continue doing it continuously. So remember, keeping your heart healthy not only reduces the risk of heart disease, but also benefits overall well-being, activity performance, and anything you want to do, then you should be able to do it. And if you're happy, kids are getting married or whatnot, if you want to dance, you should be able to dance. You should enjoy your life. You should be able to enjoy your life. And other risks, the stroke and everything else, so you can reduce all that. And other mental problems like dementia, so you can reduce the risk of that. So try to work on it in a younger age. If you started from 15 to 25 years, your whole life will run smoothly. But if you learn about it or you realize it later, sooner it's better. Thank you. There are some community resources available. They're available on HealthLink BC. You can check the website, or you can call 811, talk to a nurse, dietitian. You can talk to them, and they're open Monday to Friday from 9 to 5. Thank you. I wish to thank Dr. Sanghera, who gave us such a detailed and easy to learn information about heart diseases, about heart structure, and how to manage heart diseases. As I said, there are many questions. I'll name the speaker, then I'll ask the question. But if anybody else want to say anything, add to it, they can do that. First question from Dr. Sharma. What's the difference between a stunt and pacemaker? Can both be put in one person? As I talked earlier, we use a stunt for different conditions, and then we can put a pacemaker for different condition. If somebody had a heart attack, the stunt is usually done, and otherwise it is possible to put both. Next question is, just to add to that, stunt are put in the blood vessels. Pacemaker is a unit outside with the wire connecting to the heart into a vessel. Next question is for Dr. Sanghera. There are many questions about this topic, stress. How does that affect our heart? How does stress affect our heart? The stress we're talking about, it affects the whole body. We don't pay much attention to mental illness. We don't want to talk among our family about these things. All the mental problems we have, it increases your heart problems, your diabetes, your nerves get tightened, so it affects your heart disease. We should all try all our religions. Either you follow Sikhism or read Bible or Quran. They are all reminding us over and over again to reduce the stress. If you win your heart, you can win the world. Reduce worry and stress. It's better to reduce it, control it. It's better for better health for whole body. Next question is for Dr. Sharma. There are many questions about cholesterol. Everybody's asking, if my cholesterol is normal, that means it's not high, do I still need to take medication for it? The doctor, Sanghera, talked about it. The people say, if I've been put on medication, the cholesterol level that we target, it's our attempt to keep it below that target. If it is below 1.8, then we try to be as aggressive to reduce it. So the main point is, somebody says, my cholesterol is fine. For every person, it's different. It's based on your health. If the level is fine, if a person had a heart attack, that beside cholesterol, there are other issues that we need to control. If there is a swelling, inflammation, then it's effective for that person to reduce the cholesterol medication. And when people are much older, when they're 80, 90, and they think about, the cholesterol that we have now, that you had taken it for the whole life, you reduce the risk of stroke and heart attack, then you try to reduce the medication. But when you have heart problem, you need to take it. Yes, Dr. Sanghera. The cholesterol repair hypothesis, as we were looking at the blockage earlier, the theory that came out that it's due to cholesterol, the research you're talking about, that we did some research, fine, we gave some medication for cholesterol, that it will reduce the risk of heart attack. But cholesterol is not the only reason for heart attack. But if you don't control everything, that doesn't mean if you control one thing. If you reduce your cholesterol even 1 millimole, the research is there. What you're talking about here, sometimes people look at YouTube videos or heart attack, then the doctors say cholesterol has reduced. Then they're getting wrong information. But the complete information is there are other things, with cholesterol that you need to control, that you should control as well. Uncle, let me answer your question right away. What we are listening since this morning, there are many reasons. There are many causes that increase your risk. But then you're not paying attention to the others, you're just paying attention to the cholesterol. You need to pay attention to everything. If you're talking about online media, Sometimes it's very minor. They make it such a big fuss about it. And Dr. Sharma and others explained if you have high blood pressure and you're not able to control it, and then you think there's no need to control your cholesterol, but if you bring it together, you should try to do it all that. What should be cholesterol level? If I look at it, I send somebody for a test. They take the test paper, they control it for a month, and then they get the testing done. They'll see if it is fine, and then they start doing it what they were doing earlier. And then they say, my cholesterol was normal, and you didn't fix it. How did I get a heart attack? You need to have the cholesterol in check every day. It should be fine. Your sugar levels, the medication that we provide to you, it affects your body for 8 hours, 12 hours, 24 hours. If it is for 12 hours, then it's given twice a day. If it is for fact is for 24 hours, then you take it once a day. If you take it once a day, then 2-3 days you don't take it. It doesn't have that same effect. If we are telling you that it's to control, then you need to take it every day. To control your body, your illness, if you control it, then you won't face any problems in the future. If you don't control it, the problems are going to get bigger and bigger. And if you take half, and if you keep adding it, if you work as a team, you assist each other, then that can really help you in the long run. Let me ask all the questions. If we have some time later on, then we can ask those later. Next question is for Dr. Sanghera about blood pressure. There are many questions. They're all similar questions, so I'll just ask one or two. If you have blood pressure going up once or twice a week, then is that hypertension? If we're checking at home, how many times should we check it? How should we check it? Morning or evening? What time? And what is hypertension? So first of all, the blood pressure numbers are, if they have no other problem or illness, and there are two numbers. One is 140 and 90. It's below that. It should be below that. If you don't have any other problems or disease. If you have diabetes, and if you have heart problems or heart illness or disease, then it's tightened a little bit. As Dr. Sharma explained, if somebody has diabetes, then the bad cholesterol, it's 2.0, the target range is. But if you have that illness or disease, then it should be 1.8. Same thing with the blood pressure. If you have any other problems, then 130, it should be below 130/80. And the rest of the things, when should we check it? Try, if you don't have any worries or tension, that's fine. But if you're worried about it, then you get it checked. The more you check it, more worried you'll get it. So reduce that worry as well. You should check it according to your body, how it's reacting, and what else is happening in your life. Do it according to that. And if husband and wife are fighting with each other, then checking the blood pressure. And in the morning you get up, your body is relaxed, and your blood pressure might be normal. So those are the things you need to do at different times. And you should look, how your body is reacting to it, how it is working with it. If we eat something very salty and then check it, it goes up. but don't take it too seriously. Reduce the tension. Don't worry about your blood pressure is going up. If you check it once a week, make an appointment with the doctor, talk to them, and tell them this is fine at this time, it's going up at this time. And the teamwork is very important. That will help us. And they said, don't worry too much, reduce the worries. How can you do that?
The next question is for Gundeep. The other question is why we should do self-manage and what it is. Why should we self-manage if the doctors are taking care of us? Why should we do it? Self-management is very important. Our health is our responsibility. My health is my responsibility. My doctor prescribed the medication. It's my responsibility to take it on time. So who's going to affect it? Me. Whose health will be ruined? Mine. So take charge of your health. It's very important. We can only do this if we understand it. Because slowly, if we are healthy, so it's not important just to be healthy, but also prevent other illnesses for a long time. So if we start changing our lifestyle, it will be affecting our health, our family. When we are ill, it affects the family. Life gets disturbed, social life gets disturbed, and along with that, we burden the healthcare system. So there is already a big problem with the healthcare system, lot of problems. So self management is very important. How you do it? Just a small beginning. So here we were sitting down, we exercised for 15 minutes. If we do exercise 15 minutes at home, it will affect a lot of things. Blood pressure will be controlled, diabetes will be controlled if you make it a habit. So there will be a lot of benefit. Control your meals. If you are diabetic, it doesn't mean you cannot eat sweet at all. Maybe include it in your menu and your diet menu you have made. Make the adjustments. Even with having illness, how you can control, how you can manage. That's what is taught in the self management. How you begin it. Sometimes they will do it, just they have problem with starting it. So it's your responsibility. There are programs available and it's free of charge. So maybe you are not aware of it when you can start it and how you start it. So know yourself, tell others, ask questions, ask about education classes, ask your family where we can benefit from. It's very important to self manage. Thank you. The next question is for Dr. Sharma. Dr. Sharma, after your session, we have lot of concerns. It's about the stress close to that. If somebody has stent or bypass, how long you can live? It won't reduce their life. The second question is, if stent or bypass, we take the artery from the leg, what will happen to the leg? It's a good question, right? Next question is, after the bypass surgery, there should be still pain present, or I'll still feel pain if I already have stents. The first question was people who have surgery or bypass or stent, how it affects life. First thing is the surgery or stent is done because there was heart blockage. If once there is a heart blockage, the risk of heart attack is there. to decrease that, reduce that risk, we start medication. Bypass surgery or stent, we do it to improve chest pain or reduce heart attack. But if you don't control other things, other aspects, not controlling your sugar intake, cholesterol, then there will be a risk always. If you control all those things, and then your risk will be the same as the normal people. That's the answer to the first question. The second question is about the leg. When we take the vein from the leg, there are two kinds of blood vessels. There is a blood vessel that brings the blood to the body. The other blood vessels are that takes the blood back to the heart. That brings back the blood is vein. There is supply and connection is very good if we cut one, but the other veins are able to bring the blood back to the heart. There will be a cut on your leg, but when we take a longer vein, there will be a little bit of swelling on the leg. But you shouldn't worry about that. There is no need to fear that. The last question was life expectancy when the bypass surgery is done. Our main goal is your main heart related pain should be cured, and the heart attack risk should reduce, and the risk will be reduced in the future. But it doesn't mean that your pain will be zero. Maybe there is still some blockages, but we created a new pathway for the blood flow. There could be still little bit pain after the bypass surgery. We call it stable angina. We wanted to reduce the load at the heart. We first of all we reduce the chest pain with that. I showed you. We open the chest, so we have to cut the bones. So it takes time for the bone to heal, sometimes up to a year. For some people, think that there is a kind of pricking. That is because we open the surgery. We did the surgery by opening the chest, and there is bone that is still healing. There are a lot of questions, and I'll be keep on asking about in a line. There are questions about the heart rate, resting heart rate. When you are not doing anything, that's what it means. When your heart rate is 50 to 62, when you start exercising or started running, and then it goes to 170, is it okay? The other question is around heart rate. If we check our heart rate, can we know if our pulse is irregular or is not regular? The first question is about heartbeat. How much it go up from the regular heartbeat? It depends on the age. How old are you? How healthy you are? It depends on that. Resting heart rate normally we look is around 55. Even if you are sleeping, 55 to 60 up to 65 is normal when you are sleeping. But when you are awake, sitting down, not working, not it's normal 60 to 80. When we are exercising, it depends what kind of exercise we are doing. The formula is deduct your age from 220. So if you are doing regular exercise, it should be 80% of that if a normal person. So if a person is 60, so 220 minus 60 is 160. 130, 140 if you are exercising. If there is 25-year-old person and he is working hard, or he is doing vigorous exercise, it's okay if it goes above 200. It depends on the health and the age of the person. Like Ajay made us to do exercise. If you do it every day, if you do work hard, then our tolerance, we can increase our tolerance. Don't let the mic go. There is one more question for you. If you have heart disease, what side is better to sleep on, right or left or straight on your back? This is specific for you. If you have heart disease, it doesn't matter. You can sleep on either side. My guidance is don't sleep on the stomach. That's normally told. Don't, if you sleep on your back, then your neck also should be supported. If you are sleeping on stomach, sometimes the neck is tilted on either side, then you can't go into the deep sleep. The heart disease doesn't affect what side you sleep. There are two more questions. One is for Gandeep, one is Dr. Sharma. We are going over the time. After that, Ripujit will bring some information for you. Is it okay, Dr. Sanghera? Dr. Sharma told about the swelling on the leg. The advice is once your wounds are healed, we advise wear the stockings. There are special stockings, and then the inflammation and the swelling will go away slowly. Sometimes they use the stockings and then they stop using it. If you continuously wear pressure stockings, then it should be okay. Little bit problem is always there in the body. Thank you. You told. There is a specific question for you, Dr. Sharma. I hope I am reading correctly. So in Surrey Memorial, is there a coronary angiogram available instead of straight and coronary angiography? There is a one question in relation to that too. You recently heard that we had a campaign.
And we're still doing it. That we should have a cath lab in Surrey, that for stunts and all that. The patients who had stunts, if you came to Surrey Memorial, then we sent those people to Royal Columbian Hospital to put the stunts on. That's the campaign we did, that we should have it in Surrey Memorial Hospital, so people won't have to go anywhere else. They can do it in Surrey. We did the campaign for that. Where they put the stunt, they call it cath lab, so that's a cardiac arrest lab. Now we're doing fundraising. Our committee has helped a lot. It's still ongoing. We are trying to have a cath lab here. So if you can build a cath lab here, that can help the patients. Somebody asked a question in that regard, how they can donate. Surrey Hospital Foundation, Surrey Memorial Hospital Foundation, if you go to their website, if you wish to donate, there are numbers there. You can call and talk to them. Then they can tell you how to donate. The second question is cath lab, CT angiogram. What's the difference? It's fine. The straight cath, we can do that procedure. You can go all the way to your thigh for the tube. If you, instead of going and doing that tube, how we can do it, it's done in Surrey Memorial. Once the CT scan, there's some waiting for that. If the wait list is more and we don't want to wait, we send for angiogram. But if you think the risk is not that high and we wish to check, but we have some time, then CD coronary angiogram is done in Surrey. Last question for Gandeep. They have campaigns. When you talk to them, you can specify which campaign you want to donate to. You have to. Thank you. I can find. Last question. Our time is done. We just have a couple minutes. For us in Panjabi, that if you have resources for self-management, for the resources in Panjabi, those are available on our website. If you go on that website and put your name down and program for diabetes and chronic disease, there's a program for 6 weeks. So with the chronic pain toolkit, that's available in Panjabi as well. And you can get the contact information from outside. You can email me directly as well. And we also have a toll-free number on website. You can talk to us. And on toll-free number, you can talk only in English. But my number, you can talk to me in Punjabi as well. That's up to you, how you wish to contact us. Thank you so much. Dr. Sharma, if you can answer in short, there are three arteries mainly. Then there's extra arteries called. Some people have four, five. I was just saying that. Stents. There are three. There are three main arteries. Some people have four. They're called. There are three or four mainly for everybody. That's the first question. Said how many stunts? You technically you can put more stunts, but our attempt is if the three arteries are blocked, then we do the surgery. Then if one person had a one stunt on, a few years later put another one, and a few years later put another one, you can put more stunts. But we don't want to put so many stunts. We want to control the stunts. And the salt you're talking about, there's no such evidence that Himalayan salt or Pakistani salt is better for blood pressure. We're just saying mainly to reduce the salt intake. I wish to thank all our speakers, Dr. Sanghera, Dr. Sharma, and Gundeep as well. And from now on, we sow a seed into everybody's mind about knowledge. And they're outside, and there are flower plants on every table outside. And as I said, we give you knowledge today that you can take those plants just like those are outside. Thank you. And I wish to thank our community partners that gave us uh, sport to promote and make it successful. And thank you for media partners as well who improved it and told about this every event. And you could be here. And the presenters outside, the exhibitors, and you went there and you gained the knowledge. And I wish to thank them as well. BC Renal, City of Surrey, Diversity Options, PECs, Richmond Multi Community Services, Self Management BC, South Asian Health Institute, Surrey North Delta Division of Family Practice, and most importantly, the speakers. And I wish to thank them very much from bottom of my heart, Dr. Baldev Sanghera, Dr. Tarun Sharma, Vineet Kaur, Kashmir-based Dr. Guljar Chima, Harleen Chauhan, Ajay Singh, who gave us, fresh in our mind, Deep Sidhu, and Heart and Stroke Foundation, and translators who, some speakers who are learning. Thanks to the interpreters as well, Navdeep Atwal and Pradeep Mays. And from Ministry of Health, Ministry of Partners, and UBC as well, and Ripajit as well, who hosted this event today. Thank you. And first of all, I wish to thank you, all of you who came here and participated and made it us aware about our health and give us wonderful information. You can get all the information, whatever we did today, the recording and everything. We'll put it on our website, www.iconproject.org. If you have borrowed any headsets, please return it at the registration. before going. Our next event, and it's about chronic pains, to understand and manage it, will be Dr. Smith Chawla next Saturday, March 16, Guru Nanak Sikh Gurdwaras. And you're most welcome to join us there and attend the workshop there. Thank you. Salutations. Goodbye.